For my health issue, I decided to choose HIV, which stands for Human Immunodeficiency Virus. HIV is a virus that attacks the immune system, the body's natural defense system. Without a strong immune system, the body has trouble fighting off disease. Both the virus and the infection it causes are called HIV. White blood cells are an important part of the immune system. HIV infects and destroys certain white blood cells called CD4+ cells. If too many of these cells are destroyed, the body can no longer defend itself against infection. How is HIV caused? HIV infection is caused by the Human Immunodeficiency virus. You can get HIV from contact with infected blood, semen, or vaginal fluids. Most people get the virus by having unprotected sex with someone who has HIV. Another common way of getting it is by sharing drug needles with someone who is infected with HIV. The virus can also be passed from a mother to her baby during pregnancy, birth, or breastfeeding. Who does HIV affect? HIV affects gay and bisexual men who are more severely affected by HIV than any other group in the United States. In 2013, gay, bisexual, and other men who have sex with men made up an estimated 2% of the population, but accounted for 55% of people living with HIV in the United States. Blacks, or African Americans, are the racial ethnic group most affected by HIV in the United States. Compared with other races and ethnicities, African Americans account for a higher proportion of new HIV diagnoses in those living with HIV. In 2014, African Americans comprised 12% of the U.S. population, but accounted for 44% of estimated new HIV diagnoses. In the United States, the burden of HIV is not evenly distributed across states and regions. It is concentrated in these certain areas. Major metropolitan areas have higher rates of HIV than any other area of the country. Also, the southern United States. The rates of HIV diagnosis are higher in the U.S. South. More than 1/3 of the population lives in southern states, but the region accounts for more than half of all the HIV diagnoses. In the South, larger percentages of diagnoses are in smaller metropolitan and non-metropolitan areas. I will now discuss HIV in terms of behavioral and environmental factors. For behavioral factors, people can contract or transmit HIV by the following behaviors: unsafe sex with someone who has HIV, reusing needles, syringes, or other equipment that an HIV-positive person used to inject drugs, a mother with HIV getting pregnant and passing on the virus before or after birth or while breastfeeding, drinking alcohol and taking recreational drugs. Because these can weaken your judgment, you may be more likely to do other risky things, such as having unprotected sex. With environmental factors, HIV is shaping society's impact on the natural environment in myriad ways and at many levels. This intersection of HIV and the environment will affect millions of people, particularly in rural areas of developing countries. Local natural resources are an important means of sustenance and income generation in many rural areas of developing countries. Natural resource scarcity may lead to food insecurity and inadequate diet, which can further undermine the immune system of HIV-infected people. Malnutrition increases the susceptibility of HIV-infected persons to opportunistic infections, while also increasing the risk of HIV transmission from mother to baby. HIV also shapes household use of the local environment when it deprives family of the labor performed by household members who are disabled or die from the disease. Labor shortages are also exacerbated as caregivers are drawn away from typical household duties. These various constraints may shape decisions about the use of land resources, which is a key component of rural livelihoods in many developing regions. I will now discuss HIV in terms of economical, political, and ethical issues. With economical, HIV affects economic growth by reducing the availability of human capital. Without proper prevention, nutrition, healthcare, and medicine that is available, in developing countries, a large number of people are falling victim to HIV. People living with HIV will not only be unable to work, but will also require significant medical care. The forecast is that this will probably cause a collapse of babies and societies in countries with a significant HIV population. In some heavily infected areas, the epidemic has left behind many orphans cared for by elderly grandparents. The increased mortality in this region will result in a smaller skilled population and labor force. This smaller labor force will be predominantly young people with reduced knowledge and work experience, leading to reduced productivity. An increase in workers' time off to look after sick family members or for sick leave will also lower productivity. Increased mortality will also weaken the mechanisms that generate human capital and investment in people through loss of income and the death of parents. With politics has been the main driver of action as well as inaction and denial regarding HIV. On one hand, positive political action at both the grassroots and the governmental levels has greatly enhanced the global response to HIV. Political action on HIV has also been an opportunity to correct underlying injustices and mobilize positive political momentum around issues such as gay rights. On the other hand, politics has been a negative force at times, blocking important policy developments and evidence-informed action on HIV, particularly access to antiretroviral treatment in poor countries, prevention of sexual transmission of HIV, and harm reduction in injection drug users. With ethical, the epidemic of infection with HIV poses a more major ethical question. How can we control the epidemic and the harm that it causes without unjustly discriminating against particularly social groups and without unnecessarily infringing on the freedom of individuals? In public health, vigorous educational efforts will be required, as well modified approaches to intravenous drug use, prostitution, and homosexual and bisexual sexual activity. Carefully targeted voluntary testing and screening programs should be coupled with counseling and with guarantees of confidentiality and non-discrimination where these are appropriate. Lastly, I'll talk about the future of HIV. In the United States, it is estimated that prevention efforts have already averted more than 350,000 HIV infections. Since the height of the epidemic in the mid-1980s, the annual number of new HIV infections in the United States has been reduced by more than 2/3, and recent scientific breakthroughs have equipped us with an unprecedented number of effective tools to prevent infection. CDC believes that maximizing the impact of these tools with the framework of a new approach called high-impact prevention offers more hope than ever before reversing the U.S. HIV epidemic. Through high-impact prevention, CDC is working to advance the goals of the first national HIV/AIDS strategy and to help ensure that HIV prevention efforts have the greatest possible impact. CDC is working at the national level and with state and local partners throughout the United States to identify and implement the most cost-effective and scalable interventions in the geographic areas hardest hit by HIV and among the most severely affected populations within those areas. The vision of NHAS is the United States will become a place where new HIV infections are rare, and when they do occur, every person, regardless of age, gender, race or ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have unfettered access to high-quality, life-extending care free from stigma and discrimination.